Excellent. Thanks so much. It is delightful to be here talking about this very important topic. So this is a talk for shift workers or for people who know shift workers, people who want to help shift workers. And if you are a shift worker and this is your sleep time, thank you for being here, for your sacrifice, and hopefully it'll be worthwhile for you, and hopefully you'll get some helpful information from this. So the goals of this talk will be to explore some of the science behind sleep and shift work so that you have kind of an understanding of why shift work and how shift work can disrupt natural sleep cycles. Learn some practical strategies to improve sleep, both duration and quality, even if you're working kind of non-traditional schedules and trying to sleep and work at times that seem to contradict your own internal cycle. And then finally, we'll talk about some common sleep disorders that may also worsen this presentation and what you could do about it. I have no conflicts of interest. So starting with shift work, what is shift work? It is something that is a very common thing. There are a lot of people who work in shift work. We live in a 24-hour society, so we have industries in so many sectors that require people to work non-traditional hours. And that, of course, includes healthcare, technology, transportation, manufacturing, hospitality, security, military, huge number of people working non-traditional hours and trying to sleep non-traditional hours. And our society simply would not function without at least a sizable proportion of our society doing shift work and working at night. Shift work technically can encompass any work schedule that deviates from this traditional day shift work. It can include overnight shifts, night float. It can include very early morning shifts. It can include late afternoon to evening shifts, which are considered swing shifts. And it can include rotating shifts, either rotating clockwise where you're working successively later hours or counterclockwise where you're working successively earlier shifts over time. And some 15 to 30% of the entire American workforce is employed in shift work. And it may be that this proportion is actually increasing over recent decades. So there are more and more people who are having to deal with learning how to sleep and do work at non-traditional times. So with that said, what is the problem? The focus of this talk really is some of the sequela of shift work. Shift work requires people to work at times when they would normally be asleep, and it requires people to sleep at times when they would normally be awake. And it may seem like a simple thing to fix or to change, but it's not. So we need to understand a little bit more about our circadian and sleep biology to understand why this is a problem, why people are having problems. So we exist in the context of cycles. So all of life is attuned to kind of preset internal biological cycles that do vary by species. We exist in seasonal cycles, for example, cycles of migration, reproduction, hibernation, monthly cycles such as that of human ovulation, circadian cycles, which is more the focus of this talk, but it includes cycles of sleep, wake, appetite, hormone release, thermoregulation, bowel activity, heart rate. There are a lot of cycles that occur in our body approximately over a 24-hour period. And then even within a day, there are cycles, ultradian cycles, that include the sleep stages within a period of sleep, blood circulation, changes in heart rate that fluctuate over the course of the day, cycles of urination and appetite that fluctuate over the course of the day. We'll be talking mostly about circadian cycles. And for simplification, we often refer to the circadian cycle as a clock, because that's kind of the closest analogy that we have, which is that the clock is about 24 hours, and that's kind of the schedule that our body follows. So our internal clock is actually coordinated by something that we informally call a master clock that is in the hypothalamus, and it's called the suprachiasmatic nucleus, or SCN. And the SCN is activated by light, primarily by light, which hits some specialized cells in our retinas and travels through a very specialized path directly to the SCN, and that activates it. And that activates our circadian drive and the timing of our activation of our circadian drive. And then when the light grows dim, historically with our ancestors, that was when the sun went down. The SCN is no longer as active, and this actually releases inhibition on the pineal gland in another part of our brain, which then releases melatonin. And this usually starts 2 to 3 hours before we actually fall asleep. And it only happens in dim light. So sometimes melatonin is called the hormone of darkness for that reason. And when we're not in darkness, we may not actually release melatonin. So that's an important thing to note. Melatonin is probably what synchronizes the master clock with peripheral clocks. So all the cells in a lot of other organ systems throughout our body also have their own clocks for how they do their processes over a 24-hour period. And the timing of those processes has to be synchronized with the master clock. And melatonin is probably the way that that occurs, because it does travel through the body and binds to melatonin receptors in all of our cells. Okay, so we have this internal clock. How is this clock set? Our internal clock, the master clock, actually runs on about 24.5 hours per day, which may seem kind of odd. And this was discovered through a lot of experiments that were done in the prior century involving people going into caves or being put into very isolated situations where they experienced forced desynchrony from the outside world. And then that timing of that clock was measured, and it turns out to be a little bit over 24 hours for most people. So we have to synchronize our inside clock with the outside 24-hour world. And the way that we do that is through Zeitgebers, which translates to time givers or time cues. And these are cues from the outside world that kind of set our clock to occur at the right times. And the most powerful Zeitgeber is considered to be bright light. So our exposure, especially to the sun, is what entrains our internal clock to the outside world. And as it turns out, blue light may be the frequency of light that has the most powerful effect in setting that clock. But along with bright light, we also need darkness at specific times, again, because that triggers melatonin release, and melatonin is very important for keeping us on that cycle. The timing of food intake, exercise, temperature fluctuations, social activities, all of these are also Zeitgebers that kind of clue in our clock to be set and to keep the correct time for our daytime versus nighttime activities. Now, if we wanted to change this timing of all of these processes, this entire circadian rhythm, we can. For example, if you've ever traveled to another time zone, you got to kind of readapt and readjust to that new time zone. But the timing of our internal clock doesn't change very quickly. So it really can't change by more than an hour in either direction per day. And we can make changes by using Zeitgebers in our favor. Or in the case of travel, just by kind of letting our clock catch up to the outside time. But it's a pretty slow process. Overall, as a species, humans are diurnal. So we are most often awake during the day and asleep at night. And every species kind of has a different pattern. There are nocturnal animals. There are crepuscular animals like cats who are awake and most alert at dawn and dusk. But humans are most typically diurnal, but there is actually quite a bit of variability between individuals in our species. So there are some people who are more awake and alert during the morning, and then they tend to get sleepier towards the end of the day and go to sleep earlier and wake up earlier. There are people with an evening tendency, and they tend to want to sleep in the morning. and people who are immediate chronic. Again, there's quite a lot of variance. And this tendency, this internal tendency, is kind of built in, and it's referred to as our chronotype. Our chronotype is generally something that doesn't shift that much over the lifespan, but it does to some extent shift during certain time periods in our life. For example, adolescents and teenagers are more likely to have a delayed or later or evening chronotype. And as people get older, maybe starting around age 40 to 50 and onwards, we do tend to start having an earlier chronotype. We start becoming having more of a tendency to go to sleep earlier and wake up earlier. So there is some shifting over the lifespan. There's another important factor that determines when we sleep, which is called homeostatic sleep pressure. And this is the pressure to sleep and the tendency to feel sleepy the longer we're awake. So the longer we're awake, the sleepier we get. And it's kind of a pressure that builds up over the course of the day. And you can see that on this right-sided graph in the purple. Homeostatic sleep pressure increases as we're awake, and then as we go to sleep, it dissipates. So that pressure kind of runs off as we get the sleep that we need, and it's very low by the time we finish our sleep, and then it starts building up as we wake up. And then you can see the red line below that is the circadian drive, which is a very consistent oscillating drive. So over the course of the day, our circadian drive gets more active, and that promotes alertness. So it kind of to some extent counteracts that sleep pressure that's building up. And then when the circadian drive kind of dissipates with the darkness falling, then it causes a propensity to sleep. And that's when we drive off all of our homeostatic sleep pressure. So the cycle and this kind of coordination between both of these processes is really important. This is called the two-process theory of sleep regulation. Homeostatic sleep pressure can really only be relieved by sleep. The overnight sleep, our main period of sleep, and also naps. So naps can help reduce some of that pressure building up. And then caffeine can also reduce some of that pressure building up, but only temporarily, because once the caffeine wears off, all of that pressure is still there waiting. It's mediated by a chemical called adenosine, which builds up in our brains. So that's kind of the normal biology of sleep and circadian rhythms. And now we're going to talk a little bit about the problems that we see with shift work and why we see them. So shift work really can derail both of these sleep drives, and it can cause a lot of problems. So on the top is that graph that we just went over, showing kind of the normal process of sleep and wake and both of those drives. Now on the bottom, you can see that when shift workers stay up all night instead of sleeping, so you see that little part that says work, they are now continuing to build up all of that sleep pressure, that homeostatic sleep pressure. So they're getting sleepier and sleepier and sleepier alongside their circadian drive kind of causing them to feel sleepy. So that first night is really tough. And then the day after, when they're wanting to sleep, their circadian drive is working against them. So their circadian drive wants to be alert at that time. So they may not get great sleep. And as a result, their homeostatic sleep pressure keeps building up more and more. So there are two main kinds of problems that we see with shift workers and their sleep-wake processes. One is that they get really sleepy at night and have a hard time staying awake and alert. And the other is that they have difficulty sleeping during the day. Which then kind of snowballs the entire problem over time. Some people adapt better than others to these kinds of changes and these kinds of derangements in their sleep-wake cycle. When the problem gets really bad and people really can't adapt to shift work, it may be that they have something called shift work disorder. And this is technically a sleep disorder. It's one of the diagnoses in the International Classification of Sleep Disorders, or the ICSD, which is currently in its third edition text revision. And shift work disorder is characterized by having a lot of problems with insomnia, which is difficulty getting to sleep or staying asleep when they want to, and or excessive sleepiness during the time that they want to be awake. accompanied by reduced total sleep time during their scheduled sleep period. And this is all associated with the work schedule that they are having that overlaps with their normal sleep time. For this diagnosis, there's a time frame of at least 3 months that needs to have occurred with these kinds of symptoms. When we're considering this as a diagnosis, we get a sleep log or we put an actigraph on them to monitor their activity levels for at least 14 days, including both work days and free days, and then take a look to see how disturbed the sleep-wake pattern is as a result of their shift work. And then there's an exclusionary clause that we can't diagnose somebody with shift work if we think that their sleep or wake problems are better explained by something else, either another sleep disorder, medical disorder, a medication, a substance, or just really poor sleep hygiene, which unfortunately can be part of the problem sometimes with shift work disorder. And sleep hygiene just means like good sleep habits. Now, unfortunately, there's another level to the problems that we see with shift work. And this is above and beyond just the sleep problems, but it is something that is really important for shift workers to know. Which is that there are some kind of poor health associations with shift work. Probably the most concerning bucket out of all of these kinds of health associations is that there is a risk of cancer, of malignancies that has been associated with shift work. In fact, the International Agency for Cancer Research has actually characterized shift work as a probable carcinogen. Based on limited human studies and a lot of animal studies that have kind of shown that there could be a true relationship between shift work and cancer risk. Most of the studies on this have involved breast cancer, but there have also been studies showing increased cancer risk with prostate, bladder, and esophageal cancer. Other risks have included cardiometabolic disease, especially risk of diabetes, obesity, high blood pressure, mental health concerns, especially depression. There have been a lot of studies looking at safety risks, including occupational injuries and drowsy driving crashes. Cognitive problems are well known to be associated with shift work, which include problems with attentional lapses, slower reaction times, and even some longitudinal work showing that there may be reductions in global cognitive function that can take some time for people to recover from. And then there have been some studies also on pregnancy risks, including risk of miscarriage, hypertension, and preeclampsia. So a lot of robust work on this topic, and something that we need to keep in mind when we're talking to shift workers, which is that there could be risks beyond the sleep and wake problems. Most often when I talk to people about this, and even when I was reading about this, is what people really want to know is, what kind of risk am I at? You know, how long do I need to be doing these kinds of shifts? How many years? Like, what kinds of shifts? How can I avoid this? Right? And so there have been some studies looking at this, and it's not a clear answer. And these are usually larger studies, and they look at very large associations between populations of shift workers and these health outcomes. But it may be that there are a lot of different factors here. So how often people work night shifts, how many consecutive night shifts people work, whether they're permanent night shift workers or whether they switch, the intervals between shifts. For example, people who work quick returns, which is typically having a less than 11 hours between shifts, may have greater risk. The direction of rotation, I mentioned before that you could have a clockwise versus counterclockwise rotation, and then the shift duration. So all of these have been studied independently to suggest there could be some risk over the long term with people who work higher frequency or more consecutive shifts, shorter shift intervals, more risk with counterclockwise rotation, and maybe a little more risk with longer shifts. These are all long-term risks, though. It may also be that the amount of circadian mismatch may contribute to this. So if I'm a morning person and I'm working the graveyard shift, there's a lot more mismatch in my internal clock versus my scheduled clock than somebody who is an evening chronotype working a graveyard shift. So that may also be another factor. Another factor may be just the amount of sleep loss that people experience. So we know a lot of these health risks occur with short sleep duration, regardless of when they're actually working. So people who don't sleep as much as they should on a long-term basis may also suffer some of these health problems. There may be some lifestyle impacts to shift work. For example, people may not eat as well. They may have poor diets working at night, and they may be more sedentary, so that could also have an effect. And then there may be also just individual risk factors. For example, if someone has a genetic risk for obesity or a genetic risk for a type of cancer, it might be that the circadian mismatch and the lower sleep duration is activating a risk that they already have present. So studies that have looked at this have also kind of postulated that there are just a lot of little things that can be contributing to this. For example, there have been some studies suggesting that getting increased light at night may suppress melatonin, and that may be part of the mechanism for increased cancer risk, because melatonin can have an oncostatic effect on cancer, meaning it can, in some studies, has been shown to kind of halt the progress or reduce the progress of cancer. It may have some anti-inflammatory and immunomodulatory factors to it. And then there may be additional stressors that people are experiencing working at night, especially, high stress professions like first responders. There may be increased chance of having social isolation working at night. And then there are a lot of internal systems that get deranged with circadian mismatch that can increase problems with metabolic processes. For example, desynchrony between leptin, ghrelin hormones and glucose metabolism. So it's likely not a very simple, straightforward kind of risk, but something that's multifactorial. I want to emphasize here, though, after all of that kind of doom and gloom, that not everybody experiences problems with shift work. So there are plenty of people who do fine with shift work. And shift work disorder, which is kind of the sleepiness part of this, and the excessive difficulty getting to sleep, may occur in only about 10 to 38% of shift workers who work at night or who work rotating shifts. And the health problems are mostly seen as increased risk. They may not manifest in everyone. And it may be that workplace level factors and individual level factors can modulate these risks. So, some of these studies look at, the locus of control. So how much control does the shift worker have over their schedule? If they're able to work the kinds of shifts that they want, to what extent does that help? How long have they been doing shift work? Have they kind of learned a lot of tactics to help themselves adapt to it? There are a lot of things in here. The chronotype, how much are you working in tune with your chronotype? So some of these factors can maybe help to modulate the risk, but we don't really know enough to be able to make a kind of a plan for everybody to avoid these kinds of risks. So with that, I want to make sure this is the meat of the topic really, which is how to reduce some of these shift work symptoms. What can shift workers do to help themselves get better sleep during the day, to reduce that circadian mismatch, to feel more awake and alert at night? To note here that the only intervention that we know of that can resolve all the symptoms of shift work disorder and reduce the health risks of shift work is to not be a shift worker. Easier said than done, right? And but it is something worth considering. Some people may not do well with shift work, no matter what they do, and other people might be able to adapt and do well. So this is what I tell my patients who are shift workers, is that we can work on interventions to help, but the only thing that's really going to resolve all of this is to not be a shift worker. And that's an individual decision that people have to make. For people who do continue to do shift work, interventions should be customized to the individual. So people can experience a lot of different symptoms, needs, challenges, and sometimes, schedule limitations. There's only so much that an individual can do to modify their own schedule or to reduce the risk for sleep loss. But often we categorize these interventions within goals to either reduce excessive sleepiness during night shifts and help with alertness, to reduce difficulty sleeping during the day, get better sleep, and or to adapt one's internal circadian rhythm to the work schedule, which is sometimes but not always possible. The key for most of these interventions is the timing of them. So we'll talk about the recommended timing for each of these. You could do the same intervention at a different time of day or night, and you might get an entirely different or opposite effect than what you're looking for. So we'll start with reducing nighttime sleepiness. One thing that's been shown to be helpful in a lot of studies is to take a nap before that first night shift. So a lot of people are shifting from a daytime schedule to a nighttime schedule. And if you're able to take a nap before that first shift, you can reduce some of that homeostatic sleep pressure. And that can help you kind of remain alert at night. The important thing to remember here is that if you go into a deep enough stage of sleep, you may experience something called sleep inertia, which is kind of that really sense of grogginess and confusion that people can come out of when they are woken out of a deeper form of sleep. So allow some time, built-in time before you drive, before you do anything regarding safety, before going, if you're going to take a longer nap, or if you tend to get kind of groggy after you wake up from naps. If you're able to take naps during the shift, that may also be helpful for maintaining alertness, because then you're kind of bleeding off some of that extra homeostatic sleep pressure during the night. It may be better to do shorter naps, like 15-minute naps if you can, because that can reduce the likelihood, again, of going into too deep of a sleep and having a problem with feeling some sleep inertia when you wake up, which would then require some recovery time before you return to work. Light. So light is a huge, huge, huge intervention that is often something that works against us. If you get bright light exposure when you're trying to sleep, it can wake you up. So this can be used in your favor. If you get some bright light exposure towards the beginning of a night shift, in the summer in the Pacific Northwest, we can just go outside. In the winter time, or if you're indoors, that's not so easy to do that. There are light boxes out there, and there are even portable ones that you can take with you. The goal is to look for one that's between 2,000 and 10,000 lux. That's how bright they are. Most indoor light bulbs are like 200 to 500 lux, and they're not bright enough to produce that same alerting benefit. White or blue frequencies especially are what really work best to trigger activation of your SCN using those specialized retinal receptors again. And again, the timing is key for this. So you really want to limit exposure to light to the first half or so of the shift. Otherwise, you may start to get into the point where you're going to impair the daytime sleep that you also need to get at the end of your shift or after the end of your shift. Most of these light boxes come with instructions for how far away you should be sitting. Usually it's like 16 to 24 inches. And you just do your normal stuff with this light kind of in the ambient, in the background. You don't look and stare directly at the light. So this can be really helpful for alerting. Caffeine has also been shown to be very helpful to help people remain awake and alert. As you recall, caffeine is one of those tactics that can reduce homeostatic sleep pressure. It does that by binding to and blocking adenosine receptors in your brain. And so it kind of holds off the adenosine binding to those receptors and helping you get to sleep, which is also how it keeps you awake. If you have maybe a cup of caffeinated tea or coffee during the beginning of the shift for, just a cup every 2 hours or so for the first part of the shift, it can increase and help you maintain alertness. But if you take larger amounts, or if you start having it later, it could cause jitteriness or make you have difficulty getting to sleep when you get home and try to sleep. The half-life of caffeine really varies by individual, but the average is about 5 hours. That means after 5 hours, you still have half of it in your bloodstream. And so, if you're having trouble getting to sleep in the morning, you might want to kind of experiment with the timing to cut off your caffeine intake. I usually recommend to try to avoid caffeine at least 8 hours before you're going to go to bed, so it gets out of your system. It not only can suppress sleep onset, but can also impair deep sleep. Adenosine may be a chemical that helps you get really deep, restful sleep at the beginning of your sleep cycle. So it's something to keep in mind that you don't want to have it in your system for sleep. Just as important as light is darkness. And so we're getting into, difficulty sleeping during the day and how to prevent that. And I want to say I'm seeing questions. I'm logging them in my mind, and we'll probably try to address them towards the end. So just know that I'm not ignoring them. But I'll come back to some of these questions because they're really good questions. But I want to make sure we get through all the content. So we're talking now about reducing the difficulty getting to sleep and staying asleep during the day. So this is where darkness comes in. And darkness is just as important to our sleep cycle as light is, again, at the right time. So this means that towards the end of your shift, as you're going to go to bed, try to limit your light exposure. Try to get into a dim light situation before you go to bed. And this, again, is how your brain knows to release melatonin. So this is kind of how you are going to get your brain to know that it's time to sleep. Light really activates your circadian drive, and you're really trying to suppress that when you want to go to sleep. So if you go outside before bedtime, I recommend getting some dark glasses. This is best if you're coming home, if you're able to use public transportation, that's really going to be best for safety, but you could start wearing your dark glasses as you leave work so you can avoid sun exposure. And if you have to go outside during the day, even if you can't sleep during the day, make sure that you're really shielding your eyes from light. When you're trying to sleep, try to keep the bed environment dark. You can use blackout curtains or blinds or an eye mask, something that's going to block that light from coming in. So you're kind of mimicking darkness of night. You're using all of our modern conveniences to your advantage at this point. And then if you have a phone or tablet or computer or TV, easiest thing to say is to avoid it. It's harder to do that in reality. But if you're going to use them, a lot of electronics now have functions that allow you to dim the light or to at least reduce the blue light coming from those devices. And so try to set that up so that if you are using any electronics that would be sending a lot of light into your brain, try to set that up so that you're not getting that kind of that light exposure that's going to activate your SCN. Alongside that is reducing noise and distraction. It is very common that people have a hard time sleeping during the day because everybody else in the world is active, and they have no care in the world for reducing their noise because they think everybody's awake with them. So if you're able to use earplugs or white noise machines, sometimes that can help limit how much noise you're getting. Really importantly is working with other people in your family or your household to make sure that you're all in agreement that this period of time that you have for sleep is for sleep. So I know I have a lot of patients who have arrangements with family to do other activities to help participate in caregiving activities, to pick up kids from school or take them to school as a way of making sure that their kids are taken care of while their spouse is at work, for example, during the day, or making sure that they're equal participants in the home responsibilities. And that is important, but it's also really important that you get enough sleep and that you have enough time for sleep. So if you can at all make arrangements to have some period of time where you are not disturbed during sleep, same as the spouse is perhaps overnight, it's just as important for you to get sleep. And then probably something that's not talked about enough, which is that having a bedtime routine, regardless of when you sleep, is actually really helpful. So a wind down routine where you're kind of getting ready for bed, you're doing something pleasant, you're winding down, you're kind of, again, doing this in a dimmer environment, a quieter, cooler, nicer environment, listening to something pleasant. You could be reading a book, but that's just as important to do during the day as it is at night, because if we don't have that wind down routine, we're still sending signals to our brain to be active, and we don't want to do that. We want to wind down and be ready for sleep at the time that we want to sleep. Another thing that is difficult for people to achieve sometimes during the day, but also very important, is to keep cool. So our body temperatures go down as we sleep. They go down to a temperature minimum that occurs about 2/3 of the way through our sleep period. And if you can facilitate that, you'll get better sleep quality and you may get longer sleep duration. So that means keeping the bedroom cool. It can also mean if you can take a hot bath or shower before you go to sleep. After that, your body will dissipate heat, and that kind of mimics the decline in temperature that occurs normally with sleep. So you can take a hot bath or shower, and then you have this cool down, and that kind of tricks your brain into thinking that it's time for its own temperature to go down with sleep. You can also take a cold shower to precipitate this. Many people find the hot shower to be more soothing anyway, and then there's that temperature dissipation, that heat dissipation that helps with sleep. There have been studies that have indicated taking melatonin can help with daytime sleep. These are doses usually at between 1 and 3 milligrams or so, so fairly low doses. Your brain only produces about 1/3 of a milligram over the entire night, and supplemental melatonin is an instant release formulation that even at doses of 1 to 3 milligrams is still a lot higher than our brains produce, and it's a lot shorter period of time. But it could be helpful for some people. I always note in these kinds of talks that melatonin is a supplement. It's not a regulated medication. You're kind of trusting the label. So they can put whatever they want into those tablets, and you may not know if it's more or less, or if they have other things in there. So I usually recommend looking for an icon on there that indicates that some sort of third-party testing has occurred. Don't be tricked by other icons that they put on there, for example, saying that it's GMO free. So that could be helpful to know that you're getting what you want to get. Melatonin is generally pretty benign, doesn't have a lot of side effects, but it can include some side effects. So, headaches, next day grogginess, or later in the day grogginess, some blood pressure changes, GI upset. Some people who have nightmares have reported having worse nightmares, mood swings, even hair loss can increase prolactin. Something to avoid during pregnancy and breastfeeding, just because it hasn't been tested, with liver disease, depression, epilepsy, taking warfarin. I take some of these, like depression, with a grain of salt, because I think if people are getting better sleep, they're more likely to have better mood. And then it may be something that can change the effectiveness of blood pressure and diabetes medication. So if you have any questions about that, talk to your doctor. Some studies have shown that people who have difficulty sleeping during the day actually benefit from treating insomnia. So there's a treatment that is a first-line treatment for chronic insomnia, chronic difficulties getting to sleep or staying asleep, and it's called cognitive behavioral therapy for insomnia, or CBTI. And this is a treatment that incorporates sleep restriction, which is limiting the amount of time that you're awake in bed by really limiting your sleep window. Stimulus control, which is making sure that you're kind of adapting your association with the bed to be one of restful sleep, and so you're not just hanging out in bed awake. Relaxation training, and then challenging cognitive distortions that can lead to unproductive sleep expectations. So this is usually a treatment that's done by a trained professional, a therapist, a sleep psychologist, but there are self-guided options available, including an app called Insomnia Coach, which was made by the VA and it's free. And this is for people who are just really struggling to get to sleep and stay asleep, maybe an option that might help them. And then the final bucket of tactics to help with shift work are to try to adapt to that schedule. So this is trying to shift your clock to be earlier or later to fit your work schedule. Usually it is only a partial adaptation to your work schedule, but it could be beneficial for people who are doing longer term shift work. So they kind of shift into that mode and then they stay there. But not for people who are going to do shorter stints of night work because it takes a lot of time to shift your entire circadian clock to the time you want. So for short periods of time, it may not be worth it or even feasible. And the reason for this is that our internal clock, again, moves pretty slowly, can only shift a little bit every day. The best tactic in this bucket is something that's not really in the control of most shift workers, and it really requires kind of a top-down, organizational, systemic buy-in, really, which is to allow people to work shift times that are compatible with their chronotype. So if you're an evening chronotype, you might do best at night. If you're a morning chronotype, you may do best working early morning shifts if you're going to be doing shift work. Working a clockwise rotating shift schedule rather than a counterclockwise rotating shift schedule, minimizing quick returns, that means breaks of less than 11 hours, and minimizing doing overtime into your daytime sleep that interrupts your daytime sleep. So these are really challenging things to get around and not possible for everybody. Now, adapting your schedule, your sleep schedule around the work schedule is something that could be more productive for some people. If you can minimize changes to your sleep schedule between your work days and your non-work days, it may be that you'll have less symptoms and less mismatch. So if you're working nights and then you have some time off, don't go flipping all the way around to daytime because it's the back and forth, moving back and forth that far that can really cause a lot of problems for people. If you can't keep it the same, or if it doesn't really work for your lifestyle to keep it the same your entire career, which is understandable, another tactic that people have suggested is something called anchor sleep. So this is just changing your sleep schedule somewhat. So every day, regardless of whether you're working or not working, there may be an overlap of 3 to 4 hours when you're always going to be sleeping. So then you may be shifting it to be a little bit earlier on your days off or a little bit later on your days on, but you're not shifting it, trying to shift it 12 hours, which is unrealistic for most people. And this can reduce the amount of, work-related jet lag that you're experiencing that would worsen shift work disorder. Circadian alignment using zeitgebers. So this is using light, darkness, melatonin, to move or shift your sleep schedule to be earlier or later. So if you take melatonin at low doses, that can pull your sleep timing towards your dosage, and bright light can push sleep timing away from it. So this is really critical that you get this at the right time. We'll go over this a little bit. The shifting again occurs slowly, like 1 to 2 hours shift per day. So again, this may not be helpful for shorter periods of shift work. And for most people, it's easier to shift timing to be later than to be earlier. It's just kind of how we're built. So for example, if you have somebody here who is sleeping from about 10 p.m. to about 7 a.m., they want to shift their sleep timing to be later to prepare for nighttime shift work, they could get some light exposure towards the beginning of their sleep period. And then before they try to sleep in the morning, they could take some melatonin. And then that could facilitate moving your sleep to be a little bit later. The reason I have core body temperature minimum here is that that's kind of the anchor point for which direction the light is going to push your sleep period. So if you get light exposure before that core body temperature minimum, which again occurs about 2/3 of the way through your sleep cycle, it's going to push it to be later. And if you get light exposure after that point, it's going to push it to be earlier. So we'll see here, let's say you want to move your sleep timing to be earlier. Taking melatonin maybe 5 to 7 hours before your sleep onset normally occurs, and then getting light exposure towards the very end of your sleep period can help move your timing to be earlier, again, by just 1 to 2 hours. So it's complicated. Other factors that can get in the way of us being able to sleep well during the day and remain awake at night are actually other things like medication timing and other sleep disorders, which we really want to make sure that we are cognizant of. A lot of people are prescribed medications to take in the morning or to take at night. And it's really important to note that that may need to change or be flipped if you're working at night and sleeping during the day. So obviously things like caffeine can disrupt sleep, nicotine, alcohol, stimulants, diuretics. So a lot of diuretics are prescribed to be taken during the day. If you're sleeping during the day, you're just going to be urinating the whole time because of that. Alerting antidepressants, steroids, thyroid medications, all of these are kind of activating medications that you may need to change the timing of. And then taking sedating medications. Don't take those if you're trying to remain awake. Be really cognizant that first generation antihistamines can make people sleepy. Sedating antidepressants, anxiety medications, pain medications, and muscle relaxants can all make people sleepy when they don't want to be. So I always recommend that people talk to their doctor if they do want to change the timing of their medication just in case, especially if they're switching between daytime and nighttime, to make sure that they get adequate coverage for the conditions that they're treating. And then evaluating for other sleep disorders. So if you have another sleep disorder, this can be a double whammy, a double insult to your sleep quality and your sleep duration that can worsen problems of excessive sleepiness and insomnia. The most common one that we are often looking for is obstructive sleep apnea, or OSA. This is a condition where the upper airway collapses during sleep, causes breathing pauses, and causes fragmentation of people's sleep. So if you have any snoring, or witness breathing pauses, or really excessive sleepiness, no matter when you're sleeping, unrestful sleep, it might be worth getting an evaluation for obstructive sleep apnea, which can involve a sleep study. Restless legs is a feeling of needing to move your legs, a sensation that makes you want to move your legs. And when you move your legs, it feels a little better and then it comes right back. And this can really get in the way of people being able to get to sleep and have restful sleep. It's often worse when people are sleep deprived. So it is something to keep an eye out for and to get help for if you feel like you're having that and that's getting in the way of your sleep. Chronic insomnia is just the difficulty getting to sleep and staying asleep that is chronic, not really due to other things. But if it is occurring with shift work, again, there are treatments that may help both problems. So something like CBTI might be a good thing to consider. And then there are surprisingly a lot of people out there who are not diagnosed with narcolepsy, even though it's a rare disorder of excessive sleepiness. So this would be people who have really persistent sleepiness and no other reason for it. And they may have an intrinsic sleepiness disorder that may be worth evaluating for. So if you have a lot of other sleep-related symptoms, and if you're a shift worker, or if you're just having trouble adapting to shift work, it may be a really good idea to seek help for evaluation with a sleep medicine specialist to get help for this. Because there are additional options, especially pharmaceutical options, that could be helpful for people who are struggling with shift work. Finally, I really want to talk about something that's very important, which is the risk of drowsy driving. So people who work shifts, night shifts, are at higher risk of having drowsy driving crashes, and they may not know it. So a lot of people who drive while drowsy have kind of similar impairment as people who are driving while intoxicated, and a similar kind of inability to recognize when they're impaired. Again, they're very common with shift workers, especially in early morning hours when coming home from shifts where they've been up all night. They can be devastating. So these are accidents that can cause huge morbidity and mortality, not only to the shift worker, but to the person or people who are affected by it, other drivers or pedestrians. The best way to avoid this risk is not to drive when you're sleepy. If there is a way to take another form of transportation, such as public transportation, that's really the best option if you're really struggling to stay awake or feel alert. If you find yourself starting to get sleepy while driving, the most well-studied interventions that have been shown to work are to actually just kind of pull over somewhere safe and take a short nap. And you can also combine that with a caffeinated beverage. You can take that before the nap. Sometimes we call that an appuccino. The safety benefits are the most important thing to consider here, even if it impairs your daytime sleep. Not something that we would want to recommend every day coming home from work if it's impairing your sleep. That might require other interventions like just not driving or changing something else in your schedule. And you can also talk to your doctor if you're a shift worker and you're having a lot of trouble staying awake. Talk to your doctor about other ways that you can help. Talk to a sleep specialist as well. Okay, so that's all I got really. All of the summary here, we've all talked about this. I want to make sure I get to all of the questions here, and they kind of added up. Okay, so I'll start at the top. How does shift work affect the lymphatic system drainage? So that's a great question. To my knowledge, that has not been studied at all. But the lymphatic system has been associated with N3 sleep or slow wave sleep, which is the sleep that we get towards the beginning of our night, which can facilitate the lymphatic drainage of metabolites from the brain. And this is something that I would think can be impacted if you're not sleeping enough. And that would be kind of the main way that shift work would likely impact lymphatic system drainage. I am not aware if there is a time component to it other than the fact that it seems to be more active when we're sleeping. Is it known if caffeine is helpful for individuals with ADHD, which may have an opposite effect? So caffeine has stimulating qualities, and so anecdotally have seen patients with ADHD who use caffeine as a way to promote stimulant effects. But it is going to be similar to caffeine in people without ADHD in terms of how it affects your sleep by delaying sleep onset and by reducing sleep quality. About how long does it take your body and brain to sync to a new sleep schedule? Again, it's about 1 hour a day to move it. That's how far you can move it. So it takes quite a while to sync to a new sleep schedule, depending on how far you're having to sync. It's kind of like if you travel to Europe and you have an 8-hour time difference, presumably it would take about 8 days to fully adapt, one day for each time zone. So it can take a while. What are strategies when you're taking call shifts that are 24 to 48 hours in length every 4 days? Ooh, that's a tough one. So for that, you're really not necessarily wanting to adapt your circadian rhythm to the nighttime because you're also working during the daytime. So I would say whatever strategies you can take in terms of napping when possible. It depends also when you have sleep opportunities. If you have any sleep opportunity, then you could take it. I would take that to reduce the homeostatic sleep pressure. And then I would probably nap the next day, but only for a short time so that you can still sleep that next night. There are actually a lot of papers out there looking at interventions to help longer shift workers, but they're typically, they're never going to get you to the place that all day shift people are. They're really just trying to treat the symptoms by, getting caffeine when you can, getting naps when you can, and protecting your sleep when on days off. For rotators, is there a recommended amount of time to stay on a certain shift? Some have longer rotation periods and some have shorter rotation periods. I'm not sure that that's really fleshed out. So I'm on a task force with the American Academy of Sleep Medicine, and we're looking at all of these studies that have been done by organizations looking at different kinds of shifts and different periods of time of rotation, and it ends up being something that gets lumped all into the category of rotating shifts. So it's rarely been compared to have a longer rotating period versus a shorter rotating period. Unfortunately, we just don't have enough data to be able to say that. Often, if it's a long enough rotation period that you can adapt to it, I would say that would be ideal, that you can reduce that circadian mismatch by actually adapting as you go around, but it really depends on how far you're having to rotate it and how often. The graphic implies 5 per week, 8-hour shifts. As nurses, it's 3/12s, not only the same days every week. Yeah. So for people who are working sporadic shifts and maybe 3 12-hour shifts and not the same days, again, a lot of this is going to be more feasible to do short-term alerting and short-term sleep um, symptomatic interventions and not trying to shift your circadian clock all the way around. So that means really just trying to get a lot of light and caffeine at the right times, darkness at the right times, and you're not going to probably be able to move your entire schedule to be awake at night and asleep during the day and then back that quickly. So that is one of the limitations of these kinds of sporadic schedules. But I think part of the individual factors are that some people really like having these kinds of grouped shifts. So a lot of people like to have longer shifts over a shorter period of time and have a few days off. So that's part of that locus of control. When people have control over their schedule, they're kind of able to adapt and be resilient with it. What would be the advice for those who must do intermittent overnight shifts, the long calls? Yeah, so this is usually where we would say take a nap before that first shift if you can, or in between that daytime and nighttime. Try to nap when you can, try to get the alerting cues going at night, and then try to take a nap after the shift, but not a long enough nap that you can't sleep the following night. Yeah, I don't know if that answered the question, but it's going to be a disruption regardless, having these 24-hour shifts, but all you really can do is try to symptomatically help with the difficulty staying awake at night, and then not taking too long of a nap the next day. Does magnesium help sleep? Some people would say that it does. There's not a lot of robust literature on magnesium, but there are certainly a lot of people out there, and maybe some small studies indicating that magnesium can help sleep. This is not something that's specific to shift work, though. Is it better to work more night shifts in a row to not have to switch to a day shift schedule more frequently? It depends on what literature you're looking at. So there was one kind of meta-analysis that was in the talk that I was giving that would suggest that not having more than 3 night shifts in a row is better for your health. But again, this is not that clear. If you're able to work more night shifts in a row and then you're able to adapt to those night shifts and not having to switch back and forth, that might be better. I would let how you're feeling guide you in that decision. Thoughts on sleep tracking devices, apps like the Oura Ring? What metrics are helpful to improve sleep hygiene? So sleep tracking devices can be helpful to a certain extent because they help you monitor your habits. After a certain extent, they can sometimes cause anxiety because people are really trying to achieve a score with a device rather than using it to get the beneficial information. But what metrics are helpful to improve sleep hygiene? I think that the metrics that we will often aim for is something called sleep efficiency. So that's the percentage of time that you're asleep divided by the time that you're in bed. And that's usually what we do to track whether people are having insomnia or not, or whether they're getting benefit from treatment, is sleep efficiency. And that could be one way to help track how well you're doing with the sleep hygiene. Sleep hygiene alone may not be able to help you achieve that. You may need to do other things. Is there a long-term risk to using doxylamine? Okay, so doxylamine is like an over-the-counter first-generation antihistamine, and the evidence on this is somewhat mixed. There have been some studies that would suggest that the anticholinergic side effects of these kinds of medications might not be so good for you. They can cause some side effects like dryness, dry mouth, headaches, dry skin, constipation, urinary retention, maybe some confusion. And there is some evidence, not great evidence. This is evidence of large, samples of people using these medications for long terms or in heavy amounts that may suggest that there could be a longer term cognitive issues from doing this for a long time. So, um, you know, I think if you were really interested in getting a sleep aid, I would talk to your medical provider and talk to them and say, I've heard that these medications might not be the best for me. Is there something else that you would recommend or even prescribe? So hypnotics are not always a terrible option for shift workers. They really have to be prescribed carefully just to make sure that there are no safety issues, that you're getting enough sleep and that you're using an appropriate sleep aid. Can you please show the last slide once more? I assume, oops. This is the last slide. Anybody, you want to clarify which slide it was? That may have been at a different time. But this was kind of the summary slide. Let me know. Okay, excellent. All right, I know we're kind of bleeding over into our time here. There's still questions coming. If you want me to stay and answer any more questions, I can stay for a couple more minutes, but it's up to you.
I believe, yeah, that might have just been that last one question we just got in. But I do want to say thank you so much, Dr. McCall, for your time and sharing the wealth of knowledge that you have with us today. And thank everybody for joining. So if anyone has any other time commitment, thank you so much for staying as long as you have. And feel free to drop off at any time. And Dr. McCall, yes, if you have any, I want to be respectful of your time as well. So if you have any other time commitments, please feel free to. Yeah, wrap up, I guess. But I think that might have been just one more question from Shane
Yeah,
there, if you have
yeah,
time.
I'll just answer that one more question. So if prescribed modafinil, is there an optimal time of day for taking it when using it to assist with post-overnight daytime drowsiness? Post-overnight daytime drowsiness. So modafinil is approved for the treatment of sleepiness with narcolepsy, sleepiness with well-treated sleep apnea, and sleepiness associated with shift work. So I'm hoping that you mean this is a shift work question and not a way of not getting sleep. So this is if you have to remain awake because of your job and you're taking a prescribed wakefulness promoting medication like modafinil to treat that. Modafinil has a very long half-life, so it's a very long duration of action. So when people take it during the day, we recommend taking it in the morning, no later than noon for people who are sleeping at night. So conversely, if you're working at night and you're taking it to work night shifts and you want to sleep during the day, we recommend taking it before the night shift or at the beginning of the night shift at the very latest.
Understood. Thank you so much again, Dr. McCall, and I
Yeah.
appreciate your time again. And awesome. Well, as I mentioned earlier, this session has been recorded, and I will be sending a link out to everybody. And Dr. McCall, would it be okay to share the slides with people that have attended today?
Sure, I can send that over to you if you want.
That would be awesome.
Yeah,
Thank you so much.
yeah.
But yeah, I would want to wish everybody a happy Friday and a good start to their weekend. And thank you, everybody, for attending.
Thanks for having me.
Yes,
Bye,
thank you, Dr.
everybody.
McCall. Take care, everybody.